Hey everyone, welcome back to the channel. Today we're diving into a really important topic, chlamydia. It's one of the most common sexually transmitted infections, or STIs, especially among teens and young adults. Before we get started, I want to be super clear. This video is for educational and awareness purposes only. It is not a substitute for professional medical advice, and you shouldn't use it to diagnose or treat any condition. Everyone's body is unique. If you have any symptoms, concerns, or think you might have been exposed to an STI, please talk to a qualified healthcare professional or visit a trusted clinic. They can provide accurate testing and the right guidance for you. A lot of people don't even realize they have chlamydia because the symptoms can be incredibly mild, very subtle, or sometimes completely absent. This is exactly why awareness, regular testing, and getting treatment early are so critical. By the end of this video, you'll have a clear understanding of what chlamydia is, the 10 most common signs and symptoms to look out for, why it's often called a silent infection, and most importantly, when and why you should get tested. So, let's get right into it. First off, what exactly is chlamydia? It's a bacterial STI caused by a tiny organism called Chlamydia trachomatis. It spreads through sexual contact, and that includes vaginal, anal, or oral sex. The tricky part is that since chlamydia often doesn't show any symptoms, many people can unknowingly pass it on to their partners. But even without symptoms, it can lead to serious, long-term health problems if it's left untreated. That's why knowing the signs is your first line of defense. Now, let's go through the 10 common signs and symptoms you should be aware of. Number 1 is painful urination. This is one of the most frequently reported symptoms. You might feel a stinging sensation, some mild discomfort, or even a sharp pain when you pee. It's easy to dismiss if it's not severe, but even a slight change in how it feels to urinate is a solid reason to get tested. Don't just brush it off. Number 2 is unusual discharge. Chlamydia can cause discharge that's different from your norm. For people with a penis, this discharge might look cloudy, watery, or even yellowish. For people with a vagina, the amount of discharge might increase, or it could look and smell different than what you're used to. Any noticeable change in your body's discharge is something you should take seriously and get checked out. Which brings us to number 3, increased vaginal discharge. For those with vaginas, chlamydia often causes a noticeable increase in vaginal discharge. It might seem heavier than usual, or have a different texture or smell. Now, we all know that vaginal discharge can change naturally throughout a menstrual cycle, so it's easy to ignore this symptom. But a sudden and persistent change is a clear signal that something might be off. Number 4 is lower abdominal or pelvic pain. Sometimes chlamydia can cause a persistent ache or pain in your lower abdomen or pelvic region. This might feel like mild cramps, a dull, nagging ache, or just general discomfort during your daily activities. When this kind of pain is combined with any of the other symptoms we're discussing, it's a definite red flag. Number 5 is pain during sex. Experiencing pain or discomfort during sexual activity is another common sign. This could manifest as a sharp pain during penetration or just a general feeling of discomfort that lingers afterward. It's another one of those symptoms that's easy to dismiss or attribute to something else, but it can absolutely be caused by chlamydia or another underlying STI. Number 6 is bleeding between periods. For people with vaginas, experiencing spotting or bleeding when you're not on your period is not typical. This can be a sign that an infection like chlamydia is irritating the cervix. If you notice this, it's definitely something you should discuss with a doctor. Number 7 is testicular pain or swelling. For people with testicles, chlamydia can sometimes travel down the reproductive tract and cause inflammation. This can result in pain, swelling, or tenderness in one or even both testicles. This symptom is serious and should never, ever be ignored. Number 8 is rectal pain, discharge, or bleeding. If chlamydia infects the rectum, which can happen through anal sex, it might cause some specific symptoms. These can include pain in the area, a mucus-like discharge, or even bleeding. You might also feel itching or general discomfort. It is also important to know that many people with a rectal infection have no symptoms at all, which again highlights why testing is so essential if you're at risk. Number 9 is a sore throat. This one might surprise you. Chlamydia can infect the throat through oral sex. When it does, it might just cause a mild sore throat or some irritation that feels exactly like the beginning of a common cold. Because the symptoms are so generic, people almost never suspect an STI is the cause, but it's a real possibility. And finally, number 10 is general genital discomfort. This is a catch-all for any other subtle signs. It could be mild itching, a feeling of irritation, or just a general sense that something isn't quite right down there. Even if the symptoms are mild, they're still worth getting checked out, especially if you're experiencing them along with any of the other signs we've talked about. Now, here is the single most important takeaway from this entire video. Many people with chlamydia have no symptoms at all. That's why it's called a silent infection. This means a few critical things. First, you can have it and not have a clue. Second, you can unknowingly pass it on to your partners. And third, if it goes untreated, chlamydia can lead to very serious complications down the road, including pelvic inflammatory disease and even infertility. Testing is the only way to know for sure if you have it. There's no other way, but here's the good news. Chlamydia is completely curable with a simple course of antibiotics. The testing process is usually quick, easy, and confidential. And getting treated early prevents those long-term health problems from ever developing. If you notice any of these symptoms, or if you think you might have been exposed, getting tested isn't just a good idea. It's the responsible and empowering choice for your health and the health of your partners. So, to wrap things up, chlamydia is very common. Its symptoms can be mild, subtle, or totally non-existent. And because of that, awareness, testing, and early treatment are your best tools. There is absolutely no shame in learning about your body, protecting your sexual health, or getting tested. It's a sign of maturity and self-care. If this video helped you understand chlamydia a little better, please give it a like, share it with someone who might need to see it, and subscribe for more educational health content just like this. Take care of yourself, stay informed, and I'll see you in the next video.